Hi, thank you so much. I work at the South Carolina Aquarium, and hopefully some of you guys have been to the aquarium before. It's in downtown Charleston. Really fun place to see the natural habitats in South Carolina. My title is the Sea Turtle Rescue Program Coordinator. So we have a turtle hospital at the aquarium where we treat sick and injured sea turtles that strand along our coast in South Carolina. You know, the Sea Turtle Rescue Program, our goal in that is really to get these injured and sick sea turtles in with the goal of releasing them back into the ocean. And to date, in 7 years, we have released 27 sea turtles back into the ocean. And by the end of the year, we hope that number is going to be 30. So we're real happy with that. Now, all sea turtles, all 7 species, are listed as either threatened or endangered under the Endangered Species Act. And so the loggerhead, which is South Carolina's state reptile, and that's, you know, sort of our the most common sea turtle that lives in our waters. That's what we treat most of here because they're here most warm months out of the year, actually even some of the cooler months out of the year. I would say April through November, these loggerheads are in our waters. They're feeding, they're mating, they're nesting, so they live in our waters for a great deal of time. I have a couple of photos of turtles that are sort of before and after comparison photos. The turtles, what they look like when they come into the aquarium, and then the photo that's taken just before they get released. And that's quite a difference. Sometimes you wouldn't even recognize that that is the same turtle. You know, strandings in South Carolina, an average of 100 strandings occur every year, and only 8 to 10 of those turtles are alive and make it to our facility. So there are a lot of turtles that get hurt and get sick on our coast, and so we do everything that we can to help those animals. Now I'm just going to talk about a few of the injuries that we see that come into the aquarium. One that often that we see, but probably not even as often as we see that die on the beaches, are boat strike injuries. Sea turtles have lungs just like you and I, and they have to surface at the ocean's surface to take a breath. And so that's when they come into contact with boats. So boat strikes, and this is actually the skull of an adult female turtle that was hit by probably a very large boat, but everywhere that you see the black is where I have glued the pieces back together. Her skull was absolutely shattered by this boat. Now, when she came in, certainly she was alive and she was healthy, and we just saw 2 big fractures on each side of her head. And she lived for 3 weeks in the aquarium while we were treating her. And it wasn't until she died that we saved the skull so we can find out more about those strikes. And when I picked up this skull from the water where we were cleaning the bone off, it was just in probably 30 pieces, and all of the pieces that are in here are gone, so they were even too small to be saved. So boat strikes are certainly a real problem for sea turtles out there, and we encourage anyone who has boats, or your family might have boats, to just be aware that those guys are in our waters. We take x-rays for actually all of the sea turtles that enter our aquarium. If they have a boat strike or a broken flip or something like that, we have to take it. But if we don't see anything, like Lady Lisa here, she doesn't have any outward signs of injury, so we have to find out what's going on inside. And so we look for impaction. We know that turtles, they're out there feeding, and they might eat plastic or trash that they find on the reef. We know that we've had turtles that we found hooks in their esophagus and in their guts, and so we do x-rays, and there's a photo of an x-ray actually that our veterinarian was looking at the flipper of a turtle, which we actually had to amputate, and so that was a pretty serious injury there. We perform, many of the tests that you would see in a normal doctor's office or a hospital. We do ultrasound, and I have a photo of an ultrasound being taken of that turtle I was just talking about. Now the picture shows the turtle upside down, and that's because when we are doing an ultrasound, most of the time we're looking for either the reproductive organs or the presence of eggs in the sea turtle. So we have to get to that soft area around the rear flippers, and so you can see the in the picture, the probe is actually right around the back flippers, and then there's a smaller picture of the ultrasound screen, and you can see the eggs. And so this was an adult female who was getting ready to or had just been laying eggs, and so those eggs were present, or those were actually egg follicles, just the yolk, and she did not fertilize those because she was injured. Now I have a question from Maine. Why are they called loggerheads? That's a great question. Loggerheads are named for their large heads. These animals, in the head's size compared to their body, is very much bigger than the other sea turtle species. They feed on hard-shelled animals like crabs and whelks, which is an ocean-going snail, very similar to a conch, and lots of different mollusks. And so they have very powerful jaws and very big heads, and that's our loggerhead there. Now we get a lot of turtles that are caught in fishing gear, and whether that be a crab trap entanglements or a fishing line entanglements or hook swallowing hooks, fishing gear certainly is a threat to sea turtles out there that's left in our oceans. And so crab traps that get left for just year after year in the water, we encourage folks to pull those crab traps out of the water so that they don't become ghost traps. Lines that break, we need all the fishing gear we can get out of the water as much as possible. But what Lady Lisa came in with is what we call debilitated turtle syndrome. So she did not have any trauma. She just was very underweight, so she hadn't eaten in some time. She had a lot of external growth, so a lot of barnacles and maybe even algae and corals and skeleton shrimp, lots of little marine organisms that will coat her body, her flippers, her head, everywhere. When Mike was talking about applying those satellite transmitters, that's what he has to get off, those barnacles. And so this debilitated turtle syndrome, we take blood for these animals when they come in, and their blood values are very, very poor and very skewed. We have had to do blood transfusions. We give fluids just like you would get in the hospital. And so that, the fact that Lady Lisa was caught on the Lady Lisa out in the ocean, they caught her earlier in the disease. If she had not been caught by these folks out there studying the loggerheads, in several months she might have gotten bad enough that she would strand on the beach and might not even be alive. So the fact that she was caught early in the disease, she wasn't so far gone and has made a very quick comeback. She's a very healthy, spunky turtle. We hope within 2 weeks that we will be able to release her. We've just taken the final blood work that will clear her medically for release. And if you go to our website, www.seaquarium.org, you can find out the details of those releases, or that release and the other turtles that we'll be releasing this year. So we're really excited about that. There's even a photo of a release. It's amazing to watch these guys crawl back into the ocean and swim away. So please come out, and just remember when you're on the beaches to pick up trash. Not don't litter, but even go a step further and maybe pick up some trash that you might see out there, because these guys, they can't tell the difference sometimes between food and trash. And so everybody do their part to save sea turtles.